So what's necessary for this process to take place? Well, just listen to a few of the major things up here. There's lots and lots of little things that go on behind the scenes that we haven't even discovered yet. But, calcium, of course, everybody knows about calcium. Vitamin D is also another very important thing. But then exercise, making sure you have adequate protein matrix components, and also specific growth factors, making sure you have macronutrients, the vitamins, and also trace minerals. So we look at calcium. This is a very important mineral, not just for your bones, but also for muscle contraction. It's also necessary for that, and then also for nerve transmission. So the body is going to very tightly regulate your calcium in your blood. If it becomes too high, you'll have problems. If it becomes too low, you'll have problems. So what it does is it will go to the bones to either put it into storage or either take it out. So calcium and phosphorus are very tightly connected in our body. If calcium, or I should say, if phosphorus goes up, calcium is going to come out of bone into circulation in order to restore the proper ratio. A ratio of about 2.5 calciums to every phosphorus. So if we're really loading up our bodies with phosphorus and phosphates, it's going to start pulling calcium out of our bones. And that's where we get into a negative versus a positive calcium balance. A negative calcium balance means that more calcium is coming out of our bones than is coming into our systems to be put into bone. Positive calcium balance refers more to we're getting adequate amounts of dietary calcium, and we're not under any type of stress that's causing us to excrete it all. So when we look at this calcium metabolism, there are three major parts to this. Calcium must be absorbed, it must be stored, or it must be secreted. So for absorption, I kind of touched on this already. You have to have adequate stomach acid in order to be able to break it down so then what passes into your intestinal tracts, it can be absorbed across the intestines and be taken into your bloodstream and taken to your bones. You also need to make sure that you have a healthy gut. If you don't have good gut integrity, this isn't going to be able to absorb through, and it's just going to pass harmlessly through your body and not be assimilated into your bones. And another important thing with that is you also need vitamin D. Vitamin D, as we're going to see here in a second, is what helps us absorb calcium across our gastrointestinal tract. So calcium storage. Some of the hormones that are involved in this, calcitonin. Calcitonin is going to take calcium from the blood and put it into bone. That's kind of our storage mechanism. Parathyroid hormone does just the opposite. Parathyroid hormone is going to take calcium from the bone and put it into blood when we have a decrease, a level in circulation. Estrogen. Estrogen is going to increase the sensitivity of your osteoclasts to parathyroid hormone and make them more efficient in what they're doing and make them so that they're better controlled rather than just running wild and chopping bone up and releasing it. Progesterone is another female hormone that kind of comes into play, especially when we reach the menopausal years. But it's really important for promoting osteoblastic activity, so building that bone back up. So all these come into play, and we'll look a little bit more at the menopausal years here in a little bit. So the other thing we see with calcium is calcium excretion. So here we're looking at more of a negative calcium balance, forming that negative balance there. Things like corticosteroids, antibiotics, thyroid dysfunction, adrenal dysfunction, these are all things that are going to pull calcium out of the bones, put it into blood, and it's going to be excreted out through the urine. I talked about some of these already, but things I haven't talked about, soft drinks, refined sugar, caffeine, cigarettes, all these things are going to pull calcium out of our bones and make us excrete it through the urine. So that's why it's important, and we'll talk about this a little bit later, to decrease these things in our lives, decrease our exposures to them. Another thing is also protein, which we'll talk about here more in depth, but protein also has the same effect of pulling calcium out of the bones and making them excreting it. So vitamin D. Vitamin D is probably the second most common thing you hear about associated with osteoporosis treatment. And that's because it seems to have a role of a hormone, as we talked about, helping calcium across the digestive tract and be absorbed. There are two sources of vitamin D. You're either going to get it from your diet, and you can see here things like fish. It's fortified in a lot of our dairy products and a lot of our grains. But really where we get most of it, sunlight. 80–90% of our vitamin D is supposed to come from sunlight. So it kind of becomes a problem for us here in this northern hemisphere because we don't get sunlight as much as we need to. Vitamin D is going to stimulate calcium retention through absorption in the gut, and it's also going to make sure that the kidneys aren't spilling calcium out in the urine. And it's also going to make sure that we are storing calcium in our bones. Not only is vitamin D great for helping bring the calcium across our digestive tract, but vitamin D has also been shown here recently. There's been a lot of studies, and the recommendations for vitamin D have been changing because they've shown it's been beneficial for so many things like reducing your cancer risk, reducing your risk for cardiovascular disease, helping treat type 1, type 2 diabetes, fibromyalgia, lots of different things they found that people are benefiting from increasing their vitamin D consumption. So,
how many milligrams are they saying now?
Vitamin D, it depends on who you ask. The actual recommendation, I believe, is only 300 to 400 milligrams. So we're going to talk about the actual dosages here kind of towards the end of the presentation. And there are different types of vitamin D. Specifically, there's a vitamin D2 and a vitamin D3. D2 is not as biologically active in our bodies as D3 is. That's why we sell D3 here. That's what we believe gives the best results. And there's different potencies as the vitamin D is assimilated into our bodies and changed. So we're exposed to the vitamin D through our digestion and also through sunlight. Through hitting the skin, it's going to be converted into vitamin D3. However, this is really the least potent form of vitamin D in our body. It will actually go to the liver. The liver will convert it into a more active form, about 5 times the strength of what we take in orally or what the sun creates when it hits our skin. From there, it goes to the kidneys and becomes even more potent. There's another conversion that occurs there. And we end up with this vitamin D that is the most bioactive in our body. It gives us the maximum punch for in our intestines, getting calcium absorbed across the intestinal barrier. So you can see what could happen if anywhere along that pathway things break down, either if we have some skin disease, if we have some gastrointestinal disease, if we have liver or kidney disease. We're not going to be converting vitamin D at the rate we need to and be producing amounts of vitamin D that we need to. Also, as I mentioned before, northern latitudes, we don't get as much sun exposure as we need to form this vitamin D in our bodies. People who are elderly, dark-skinned, or obese also do not have as good a mechanism to convert this vitamin D. So exercise. Exercise is something else that is vitally important. In fact, there's been studies that have shown that it is probably the most essential aspect of maintaining your bone health for years to come. This study here showed that weight-bearing exercise 3 times a week for anywhere from 20 to 60 minutes did that over a period of a year, and they tested their bone density after the fact. 12.6% increase in their bone density, which is pretty amazing. That's better than most medications will give you. So exercise definitely vital for maintaining your bones for the future. Proper nutrition. Lots of studies showing that a vegetarian diet, people who are vegetarians don't get osteoporosis nearly as commonly as people who are meat eaters. Not that I'm a proponent of vegetarianism, I am not, but definitely incorporating more good whole food into your diet is the way to go in this. Possible mechanism behind it, decreasing protein and phosphates. So you're not having to pull that calcium out of your bone in order to buffer those coming out into your system. Also, you get increase in your vitamins and cofactors that you need to build your bones. So some dietary changes that pretty much everybody can make and needs to make just in order to maintain overall health is, of course, cutting out your processed foods and your packaged foods and incorporating more of your fresh foods, your organic produce and your farm-raised, your grass-fed beefs and your free-range poultry, things like that, where you're getting good nutrition with it, you're not getting the contaminants from traditionally raised food. Growth factor is also something that's very important to developing bones. And insulin-like growth factor and transforming growth factor are both things that are very important to spur this process along. And as you'll see here in a little bit, the product that we sell here includes both of these, and it's one of the only products that does. So we need the necessary vitamins and minerals as well. Vitamin C is very important for making collagen, the protein component of our bones. Vitamin K1 is very important for decreasing the excretion of calcium in the urine, and it works along with boron and calcium, and it forms osteocalcin, which is it's a conglomerate of protein and mineral in the bone, and it helps hold calcium in place and kind of provides some structure and stability there. So all these things are things that we need in order to keep our bones healthy. But the unfortunate thing is a lot of us aren't getting these in our diets. You can see the things that give us vitamin C, lots of fruits and vegetables. The things that give us vitamin K, lots of fruits and vegetables. So a lot of people aren't getting the adequate amounts that they need. So a lot of times we need supplementation in order to make sure people are getting as much as they need. So now we come to the time. We talked about a lot of things that contribute to bone development. But what is the actual cause of osteoporosis? What is the underlying factor that we need to take care of? Well, we'll look here first at calcium. And calcium, as we saw, is definitely an important piece of the puzzle because it is incorporated into bone. Gives it a lot of structural stability. However, there have been numerous studies, and I highlighted a couple of them up here, about people who take calcium supplementation for over a period of time and don't see any change in bone loss. And also some studies here showing people who have low calcium diets and low protein diets actually have less chance of developing osteoporosis and a lot of other diseases as well. Still another study showing people, a population study of Alaskans and Canadians, showing that these people normally have high calcium, high protein diets, actually have a higher risk of osteoporosis. So it doesn't quite correlate. The calcium is the only thing that's being affected here. Again, this is very controversial because there are plenty of studies that do show that calcium supplementation does help stop osteoporosis. Unfortunately, it doesn't help build bone back that much. So that's one area where calcium does fall short. So now we look at protein, and you kind of saw in this previous slide that there was a tie between calcium and dietary protein. And we see that the recommended daily protein, 68 grams per day for a male, 48 grams per day for a female. The average American intake is 93 grams per day, so far exceeding what is recommended for us. And there's been studies here showing if we increase your protein intake from 47 grams to 142 grams per day, it will double the calcium excretion in your urine. So there's definitely a tie there. So we saw on the previous slide people who have diets high in calcium, high in protein, still osteoporotic. This could definitely be something that could explain why that happens. Here's another study. People who were supplemented with 1,400 milligrams of calcium per day, but with varied amounts of protein. People who ate triple protein versus people who just ate a single serving of protein had quadruple the amount of calcium loss. And again here showing meat eaters have 5 to 6 times the risk of developing osteoporosis as opposed to straight vegetarians. Dairy. And unfortunately, this is an area where I just have a weakness, especially for this stuff here. But is it a good source of calcium? It is. There's lots of calcium in dairy. The unfortunate thing is it's also high in protein. Not only is it high in protein, it's also high in arachidonic acid and phosphorus. Arachidonic acid being a very inflammatory chemical in our body, also drives up our osteoclastic activities. So not a good thing. It's also high, it leaves an acid ash residue, which is not a good thing. So our body has to come in and buffer, and we'll talk a little bit about acid ash here on the next slide. The Harvard Nurses study was a big study that was done on this. It's shown that 3 glasses of milk per day actually increase the risk of fracture by 45%. So kind of negating that correlation between dairy and decreased risk of osteoporosis.